Thank you for joining today. My name is Kerri Cornejo, and I'm the Policy Coordinator in the Federal Office of Rural Health Policy within the Health Resources and Services Administration. The purpose of my presentation today is to give you a short overview of the issues related to funding telementoring programs. In short, the main issue is that telementoring programs need both upfront and ongoing sources of funding. I'm going to delve into the issue by first providing a look at what we know about how telementoring programs are funded currently. Then what opportunities exist or what strategies might emerge to support sustainable telementoring programs looking longer term. As you can see here by the definition of telementoring, it's a way to deliver training, education, and support outside of the in-person face-to-face setting and expand the capacity of the rural health workforce. A recent report from the U.S. Department of Health and Human Services identified funding and financial sustainability as challenges to maintaining telementoring programs. This is especially important considering various program activities that may be outside of the realm of typical billable services. And while grants have been key funding mechanisms for telementoring, they may not be the right strategy for long-term sustainability. And a big issue there is that grant funding is often time limited. So telementoring programs funded through grants may need to consider other avenues of financing to ensure continued access to their services. As you can see here, federal support, particularly through grants, is a major funding source for telementoring programs. In the HHS report I just mentioned, 32% of funding for the telementoring programs studied were grants from my agency, HRSA. However, telementoring programs are also funded through a number of other mechanisms. For instance, some states have used funds through their Medicaid programs to support Project ECHO activities, including New Mexico, Oregon, California, and Colorado. A brief from the Center for Healthcare Strategies noted state Medicaid programs and their delivery system partners leveraging strategies such as 1115 waivers and accountable care to fund telementoring. And circling back to the HHS report, it also documented some activities of telementoring models to sustain their programs, including establishing fees, subscription models, and other mechanisms to offer paid services. I'd also note the establishment of codes for things like interprofessional consultations and chronic care management, and their adoption in Medicare in recent years. And while I'm not an authority on billing and don't mean to suggest anything about using these codes for telementoring specifically, they do reflect a recognition at the federal level of the benefits of funding information sharing activities that aren't directly patient-facing. So taking everything we know about how telementoring programs are currently funded and the gaps and opportunities there, what are some of the strategies to sustain telementoring programs longer term? First on the list here is diversifying funding sources for telementoring. Grants are wonderful opportunities to get upfront funding and support activities that others might not pay for, but they don't usually last forever or cover all the funds you might need to support a growing program. And a related question is, what is the ideal balance of funding sources and how might this change over time? Value-based care models, like accountable care organizations and others, may be promising strategies to support telementoring. They have a focus on innovative payment models that can often fund activities that improve health outcomes, but aren't traditional billable services. And lastly, the HHS report I discussed talked about the importance of balancing the enthusiasm for telementoring programs with the need to gather evidence on their effectiveness. And taking this point a step further, looking at the long-term future of telementoring, on the federal side, at least, it's so valuable for us to have this evidence base to support our programs and policies. And out in the field, a strong evidence base could help build the case to further incorporate proven telementoring activities within our healthcare system.